So for this video, I am going to be explaining some manual percussion, kind of some postural drainage. I don't have a patient to kind of demonstrate some of these positions with, so I'll just kind of explain the best I can. It's kind of hard in this sense, but I'll do what I can. So we'll just kind of go with a few easier ones. That way I can kind of demonstrate with my hands positions. So I'll say I'll do my assessment. Introduce myself, department. Kind of let the patient know that I'm here to, or that there's some secretions that are stuck that I can hear. That we're going to do some maneuvering some positions. That way we can get those secretions to, or the mucus to kind of get out of their body. So we'll say I hear it on their left side, so like left posterior segment. I'll just have them lay flat on the bed, be tilted at, I want to say about a 45-degree, maybe a little less. Have them put a pillow underneath their left side, kind of underneath their elbow and their like armpit area, kind of like they're hugging it with their elbow and their knee, kind of relaxed, and I'll proceed to like percuss. And when you percuss and you're gonna do manual percussion, you're gonna want to use a like a cupped hand. So you want your like thumb and your fingers kind of in, and when you're doing it, you want to kind of have a loose wrist, and it was like you can practice on your thigh and whatnot, which is kind of a good way to do it that way. Or a family member, who is comfortable helping. That way you can get kind of used to not doing it too hard. That way you don't injure the patient anyway. So like, we'll say the patient is, you can hear them in the lower lobes of the lungs, any secretions that are stuck. So we'll say left lateral segment. So you'll just have them lay on the right side. So basically gravity is going to take toll of it, and you're going to kind of put them at a decline in a sense. You're going to want to raise like the foot of the bed. This is about a foot and a half or so. Have them on the other side. Put a pillow, behind the head. As whatever, as long as they're comfortable, and then you're gonna kind of do the percussion. And it should be loud enough for you to hear, but it's not going to, like I said, injure the patient in any way. You want to make sure that you're not doing it over any buttons or anything that can be pushed into the skin, pushed against the rub. That way, there's no poking that's going to hurt them, or something's not going to rub and kind of injure them in any way. So basically, these positions, a majority of them are laying flat at an incline, so their body's at an incline, or they're going to be laying flat and their feet are going to be up. And basically, depending on which side they're laying on, is where the secretions are going to kind of drain out from. So let's say they're on the right middle lobe, so you will be laying, kind of have them lay on their back, put a bell under the back, and roll to the right, and it'll help kind of drain it as you percuss. It'll loosen it up, and I'll have them cough afterwards. After this therapy, I would just reassess them, just kind of look at their vital signs, just listen to their lung sounds, the breath sounds, and just kind of see if things have improved, and if so, then this airway clearance kind of worked for them, which is the main goal of it.